Good morning, this is Dr. Rajesh Yadav, Assistant Professor and Head Dialysis Technology, School of Allied Health Science, Sharda University. Now we will cover the topic hemodialysis. So what is the hemodialysis and what is the requirement of the dialysis? So hemodialysis need start when there is a problem occurs in the kidney. We know the function of the kidney, it removes the excess water, solute and toxin from the blood. If there is any reason by which if kidney failure occurs, but either it is acute kidney injury or chronic kidney disease. Due to any reason, if kidney is not working properly, then there is a need of the dialysis. So kidney dialysis is the process of removing excess water, solutes and toxin from the blood. Dialysis was first successfully performed in 1943. So dialysis requirement in either in the acute condition or chronic condition. If we talk about the chronic kidney disease, so in the stage of 5 chronic kidney failure is reached, then it is requirement of the hemodialysis. Glomerular filtration rate when it is less than 10 to 15% of the normal and creatinine clearance is less than 10 milliliter per minute and the uremia occurs. In that condition, there is a need of the dialysis. In Australia, Canada and United Kingdom and United States, the dialysis is paid for the government for the specific peoples who are eligible. In the research laboratories, dialysis techniques can also be used to separate the molecules. For the dialysis in the laboratory, semipermeable membrane is used, which is made up of cellulose acetate or nitrocellulose. This can be used to purify protein of interest from the complex mixture by removing small proteins and molecules. The kidney also functions as a part of endocrine system which produce erythropoietin hormone, calcitriol and renin. Erythropoietin hormone is involved for the production of the red blood cells, while the calcitriol play a role for the bone formation. So dialysis is imperfect treatment to replace the kidney function because it does not correct the compromised endocrine function of the kidney. So dialysis is only used for the removing of the toxic material, but it cannot produce the erythropoietin hormone. So that is why it is not perfect solution of the kidney. So definitely it is a need of the kidney. Dialysis treatment replace some of the functions like diffusion and ultrafiltration. Dialysis use highly purified water. So in the kidney, glomerulus is act as a filter. So there is a replacement of the glomerulus in the dialysis machine that is called dialyzer. So dialyzer is equivalent to the glomerulus. Now come to the principle of the dialysis. The principle is based on the diffusion and ultrafiltration, which require the semipermeable membrane. Now come to the diffusion. So diffusion is the process by which solute particle move from high concentration to the low concentration. In the dialysis, diffusion of the toxin and waste material occurs from the high concentration from the blood to the lower concentration, that is a dialysate. So in the dialyzer, in one direction blood is coming, while in the another direction dialyzer is coming. So in the figure it is shown here, blood is coming from this side, while in the dialyzer dialysate is coming from this side. So from the diffusion process, high concentration of the molecule toxin material diffuse in the dialysate. Now the another principle is the ultrafiltration that require hydrostatic pressure. That can be achieved by applying the negative pressure to the dialyzer compartment of the dialyzer. This pressure gradient removes the water and dissolve solute from blood to the dialysate and allow the removal of several liters of the excess fluid during the 4-hour treatment. So for the dialysis, 4 hours is needed. So come to the classification of the dialysis. It is mainly of two types. One is the hemodialysis, second is a peritoneal dialysis. So our focus will be on the hemodialysis. So come to the hemodialysis. In hemodialysis, blood loaded with the toxin and nitrogenous waste like creatinine and urea is diverted to the machine that is called dialyzer, in which blood is cleaned and returned back to the body. So dialyzer acts as an artificial kidney or synthetic fiber is present which is act as a dialyzer. So before starting the dialysis, there is a need of the surgery that is called vascular access. So there is a three type of the vascular access. One is the arteriovenous fistula, that is also called AV fistula. Second is the arteriovenous graft, that is also called AV graft. And third is a tunneled catheter or tunneled catheter. So come to the arteriovenous fistula or AV fistula. So in the AV fistula, surgeon connect the artery and veins in your arm. So that is a maturation time is 3 to 4 months, and there is a high patency in the arteriovenous fistula. There is a lower risk of the infection in the surgery and lower risk of the thrombus formation. But there is some risk of the Steele syndrome, that is called poor blood supply to rest of the body. And second possibility, the aneurysm formation, where the abnormal bulge or ballooning formation occur in the wall of the blood vessel. So there is a significance of the graft or fistula. So what is the significance? AV fistula and graft enlarge the connection between the artery and veins, which make dialysis easier. And second things, they also help blood flow in and out of the body in faster speed. So in the figure here is shown one radial artery and cubital vein is used, and this graft is called straight graft. While in the second figure, there a loop graft is used between the brachial artery and cubital vein. So this is type of the loop. In the another figure, it is shown here that is a radial artery and cephalic vein. So fistula occur between the radial artery and cephalic vein. In the another figure, it is showing radial artery, that is a radiocephalic fistula between the radial artery and cephalic vein, while another is a combination of brachial artery and basilic vein, that is called brachiobasilic fistula. Another surgery that is also called arteriovenous graft. So if the artery and veins are too short to connect, then the surgeon uses a small loop, that is called graft, which connect the artery and veins as shown in the figure. So maturation period of AV graft is 3 to 6 weeks, and it has poor patency, but sometimes require thrombectomy or angioplasty. There is a risk of infection also, and there is also infection of Steele syndrome and aneurysm formation. Now come to the ray diagram of the hemodialysis. In the figure you can see here there is a patient, and blood is first withdrawn from the AV fistula or graft from your arms to the blood pump. And before going to the blood pump, there is an arterial pressure monitor. We check the pressure of the arterial blood. And through the blood pump, it goes to the dialyzer. And before entering into the dialyzer, heparin is injected here. And also the pressure monitor is here, which measures the pressure of the blood. When blood reaches to the dialyzer, the another important things that is called Dialysate. So Dialysate is coming from this box or container to the dialyzer, and used Dialysate is coming in the another container. So in the dialyzer, the diffusion and ultrafiltration occurs, and after the purification, the blood goes to the body. And before entering into the body, it is also checked either the air is trapped or not, and venous pressure is also monitored here. So this is the basic mechanism of the hemodialysis. Now come to the dialysate. So we have a study about the dialysate that is filled into the dialyzer. So what is the composition of the dialysate? So dialysate is a fluid that is made up of water, electrolyte and salt. Dialysate solution or dialyzing solution is a non-sterile aqueous electrolyte solution that is similar to the normal level of the electrolyte found in the extracellular fluid, except bicarbonate buffer and potassium. Dialysate solution is almost isotonic solution with the usual osmolarity is 300 plus minus 20 milliosmol per liter. So as we measure the concentration in the molarity and molality, in the same way we can measure the concentration in the blood in the form of osmolarity or osmolality. So molality is equivalent to the osmolality. Now, to ensure patient safety and prevent red blood cell destruction by hemodialysis or clinician, the osmolarity of the dialysis must be close to the osmolarity of the plasma. So the osmolarity of the plasma is 280 milliosmol per liter plus minus 20. So there is a concentration of the 6 electrolyte or ion is present in the dialysate like sodium, potassium, calcium, magnesium, chloride, bicarbonate. So we can differentiate of the dialysate to two parts. One is a part A and part B. In the part A, mostly electrolyte is present like sodium chloride, potassium chloride, calcium chloride, magnesium chloride and glycyl acetic acid in the different concentration. While in the part B, sodium bicarbonate and sodium chloride is present in specific concentration. Now come to the dialyzer. Dialyzer acts as a glomerulus in the kidney. So in the hemodialysis, the patient blood is pumped through the blood compartment to the dialyzer where semi-permeable membrane is present. So dialyzer is composed of thousands of synthetic fiber. As shown in the figure, 20,000 fiber is present in this dialyzer. And the wall of the diameter is 0.035 nanometer. We can see here a large view of the dialyzer. It is shown sympathetic membrane, semi-permeable membrane is present here. And this is the commercialized dialyzer which is present in the hemodialysis. Now come to the mechanism of the dialyzer. The blood flow in one direction and the dialysate flow in the opposite direction. As we have already discussed in the dialysis, blood is flow from in one direction and dialysate is current in the opposite direction. So if two solution is coming in the opposite direction and the exchange occurs of the mineral and water, it is called counter current mechanism. So we can see that counter current mechanism occur in the dialyzer. So counter current flow of the blood and dialysate maximize the concentration gradient of solutes between the blood and dialysate, which help to remove urea and creatinine. The concentration of solute normally found in the urine are undesirably high in the blood but low or absent in the dialysis solution. Constant replacement of the dialysis ensures that concentration of the undesired solute is kept low on one side of the membrane. Dialysis solution has high level of mineral like potassium and calcium that are similar to their natural concentration in the healthy blood. For another solute, bicarbonate dialysis solution level is set at a slightly higher level than in the blood to encourage the diffusion of the bicarbonate into the blood to act as a pH buffer to neutralize the metabolic ester that is often present in this patient. The level of the component of the dialysate are typically prescribed by the nephrologist according to the need of the individual patient. This is the reference of the hemodialysis. Thank you.